This episode is made possible ad-free by Hills Pet Nutrition. Let's get into it. Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I am here with my friend, Dr. Caitlyn Getty. Caitlyn is a boarded nutritionist, and she has a PhD in nutritional sciences, and she is a nutrition guru. She is one of those people who has a thing as nutrition, and she is stoked about it. And these people always get me excited when I get to talk to them about the thing that they love. So I have a question for Caitlyn today. I'm bringing her one of our how do you treat that cases, and I'm coming with Murph. And Murph, he is an 8-year-old male-neutered Yorkie that has a very, very fragile, sensitive stomach. He's an irritable bowel dog, not food allergy, but he is one of those, he's very prone to pancreatitis. He's very prone to gastroenteritis. And now, guys, his kidney values are up. I'm worried that he's an early renal dog. I do not want to mess with his diet. His owners really are worried with, are we going to mess with his diet and cause just a explosion of vomit and diarrhea? And how do I maintain Murph if he is so limited in what he can do? And so anyway, this is a fun case. It's interesting to look at from a nutritional standpoint. I think Caitlyn does a great job of sort of breaking it down about what she's looking for in a diet and in maintaining dogs like Murph for the best long-term outcome. And then we get into the Hills Canine Multi-Organ diet, and we talk about what that is, how that works, why that's great for cases like this, what other cases it's good for, and also when maybe we don't want to reach for it. So guys, that's what we got going on. It's a really good episode. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast. Dr. Caitlyn Getty, how are you, my friend?
I'm doing awesome. It's sunny, it's gorgeous, and I'm excited to be here.
Well, I am thrilled to have you here. For those who don't know you, you're a veterinarian, you're a boarded nutritionist, and you also have a PhD in nutritional sciences. Is that I got that right?
You did. You absolutely did.
Excellent.
I got confused too when I was a grad student.
At some point, I don't know if you remember all the letters behind your own name. There's so many of them. So anyway, I am super thrilled that you're here. I want to run a case by you today and do a little, how do you treat that? Does that sound okay?
That sounds perfect.
Good. I have an 8-year-old male-neutered Yorkie named Murphy, and he goes by Murph, aka the Murfster. So Murph is a special child. He has a chronically soft stomach. This is a dog that if he likes to steal food, he loves to sample treats. He begs for food all the time. And if you give him anything, he erupts into diarrhea and vomiting. Like that's his party trick. Yeah, that's his party trick. And so I got Murph pretty well ironed out. He's been on ID for some time now. It works really well for him. He's not a food allergy guy. He's just an irritable bowel disease kind of, very sensitive, reactive GI sort of guy. And in response to his tendency to steal food and explode in diarrhea and vomit, his owners have become really protective of his food. Like they got something that works. He's well regulated. They are like white knuckling, holding on to ID, and they're like, "This is our jam. Like this is our thing. And as long as we do this and we don't deviate, everything is fine." But Murph has got some renal insufficiency. And I don't like the trend lines of his renal insufficiency. So his BUN is creeping up, his creatinine is creeping up, his urine specific gravity is creeping down a bit. We're getting to a place where I feel like we need to start trying to show those kidneys some love. And so I'm looking at that, and you sort of my go-to around kidney disease is generally sort of nutrition and nutritional choices to help support those patients. I want the Murfster to have the longest life possible. His owners want that too. But again, they're really worried about tinkering with the diet that he's got. And so I want to talk to you about how do I approach this? How do I treat this? And then once I kind of have a plan with you, how do you approach the messaging of this back to the clients to sort of help them get on board with any changes or modifications we want to make? And so let me stop talking there and just sort of say, that's Murph. That's what I'm looking at. I'm going to slide him across the table to you and say, Caitlyn, how do you treat that?
Awesome. And these are my favorite, these kind of complicated you've had them well maintained for a long time and now you have something new. What are we going to do about it? And so as you slide the Murfster across the table and I'm feeling he's spicy. He seems like a spicy guy.
Yeah, he'll bite you. Just be careful.
But I also feel like his record is about this thick because these owners seem like they've been in to see you, maybe 2 to 3 times a year for what's going on. We've got some really great trend lines.
Every time he steals something and eats something, he comes to see me. Every time. And it's a lot.
So this is a dog where we actually have a great dietary history and we can see kind of what makes him react. And maybe if we look back, we see, maybe he got a piece of roast beef and that might be a little fattier than he can handle. Or he got some, a whole bag of dog treats and that's more than he can deal with. So it sounds like we want to keep him. So for his GI issues, we want to try to keep him in that highly digestible camp, like the ID, like the GI diet category. Try to keep the fat. So the fat and ID is kind of what we consider moderate. So if you're looking at like a product guide, for example, we say like 3 to 5 grams of fat per 100 kcals would be moderate. ID sits kind of right in the middle of that. So we want to keep it there or lower. But then we look at the renal disease, and that is his second issue that we need to focus on while also maintaining his GI health. And you look at how renal foods are formulated. And of course, they're going to be low in phosphorus to help reduce that work on the kidneys. They're low in sodium to help, again, reduce work on the kidneys, reduce possible blood pressure issues. They tend to be lower in protein, which maybe in early stages we don't need super low in protein, but it kind of depends. We'd have to look at his trends and how he's doing. And then they have a handful of other things in there, things like omega-3 fatty acids to help with blood pressure and renal hypertension and inflammation. But also because a lot of these kidney patients aren't eating well. So like in our later stages, those stage 3, 4 dogs, especially things like a Yorkie that might get super, super picky if they're not feeling well, these foods are very calorie dense and they tend to be pretty high in fat, which also happens to make them taste good. And so if you think about a dog like Murph, who is really, really sensitive about dietary change, going from what we would consider a moderate fat diet to a more of a higher fat diet makes me a little bit nervous. And so then we've kind of got a conflicting nutritional need for this dog. And what do we look at to try to find the correct food for him? Right. And so when I was a resident and when I'm looking at cases like this, I like to make a list of all of the nutrients I'm considering. So I'm looking at phosphorus, I'm looking at fat, I'm looking at digestibility, not a nutrient, but I still consider it kind of a nutritional factor and something I'm considering.
I like that.
And I make a list and what do diets look like and where do they all rank? And what I find when I make a list like that is that there's no one diet that's going to be the most perfect for kind of every combination of conditions, but there are diets out there that might be pretty close to what we're looking for each condition. So we can try to get something that's going to be highly digestible, keep it moderate fat, but then also going to be kidney friendly for those earlier stage renal patients. And so when I'm thinking of something like that, I'm thinking of the new Canine Multi-Organ because it's going to be that kind of combination and like conflicting nutritional needs. It kind of, it tries to go in and address the different kind of more middle of the road. How are we going to treat these kinds of patients? It's not the lowest protein, but this Murph dog probably doesn't need a super protein restriction. It's, right at the beginning levels of phosphorus restriction for a kidney dog. It's got a lower fat. It's highly digestible. And so that might be the kind of food that I'm going to reach for because it's suited specifically for those conflicting needs. Maybe it's not as kidney diet and not as GI diet, but it's kind of situated right in the middle.
This makes sense to me. I need to keep Murph on the straight and narrow as far as his GI upset. But like I said, he's not a severe renal dog. I'm just seeing progression, and I want to make sure that we're managing it. That makes sense to me. Talk to me about how you sort of introduce these diets, something like this. So I've got this dog, and they're sort of fragile. Mom and dad like to hold on to sort of the diet that they have.
Yes.
When you start to transition like this, if you're going to say, I'm going to try, the multi-organ diet, how do you start to introduce that? I mean, I can imagine, I don't know, are there extra considerations given? Let me pause here for a second and be honest about Murph. He's fragile. he's fragile. And so, and again, I know that sounds silly, and I should just be like, just we're switching and we're going to do this quick transition. But is there any way I'm going to mess this up? Is there any way that I can smooth this transition? Because if I switch him, Caitlyn, and he explodes in diarrhea and vomit, I'm going to have a lot of cleanup to do in a metaphorical client customer service sense. And so help me with that. Are there any best practices in making transition here?
Absolutely. And I think, he might be fragile, but a lot of dogs and cats, I would consider every dog and cat fragile if we're worried about, them having some kind of health condition, wanting to make any kind of treatment change.
Sure.
And then the clients, right, of course, are worried about their pets. They want the best for them. They want to avoid any kind of issue. And so I think the slow transition is going to be the best bet. So not we ran out of a bag that we're feeding now and we have this new bag of this new food. So we're just going to start switching to that new food right away. That seems like Murph might have a little bit of an issue, probably a blow up. And usually when we're doing a transition, I would think over maybe a week, you start doing 25% of the new diet, 75% of the old diet, gradually switch over until you're at 100% of the new diet. But with the dog this sensitive, I'd probably try to do that over 2 to 3 weeks to try to slow down, those changes in the nutrient profile. They're going to have different ingredient sources, similar, digestibility and things like that. But any kind of change can make a sensitive dog have an issue. So trying to go slowly, work the new diet in. If you notice an issue, maybe back off, let him resolve, and then you can keep going. And slowly it's going to be our way forward here, especially because he's so new in his likely renal disease. I don't think we have to rush into a new food. I think taking our time really benefits Murph here.
I think a 2 to 3 week transition is well beyond what I had in mind, which makes me feel good. Like that actually is like 2 to 3 weeks is a long transition. And so, but again, I like that. And I like, if I set that expectation and say, this is going to be a 3 week transition, like this is how we're going to do it and sort of map it out for the clients in percentages. That makes sense to me. Talk to me some more about sort of canine multi-organ in general. So, we're looking at Murph and he's a renal dog, sort of a GI upset dog. This diet can't be a panacea. It can't be. It's multi-organ. Like this is the only diet you ever need because everything is an organ. Like talk to me more. When do I reach for this?
So this diet, I don't know who's familiar with GD out there. So GD is kind of the predecessor diet, which was a similar, low-fat, highly digestible kind of renal diet. This is GD's new fancy cousin. This is the upgraded version of GD. And so one of the big facelifts of this food is that we actually added omega-3 fatty acids, which is super important for our kidney patients. It helps reduce that inflammation, like I mentioned before, but also is going to help with any kind of systemic inflammation. We mentioned the GI diseases, and it's also good for fat sensitivities in dogs. It's not a ultra low fat, but it is in the low fat category. So, you're super, super sensitive. It might not that you need super fat restriction, maybe not, but like the ones that you're like, I need to go lower fat. I have something else going on. It's a really nice diet for that. The other things about this food, so I mentioned before that it's going to be lower in sodium. Mm-hmm. It has those omega-3 fatty acids. It also has carnitine in there, which back to biochemistry, if we think about lipid metabolism and the heart and how muscles get their energy, they need carnitine to get those lipids into the inner mitochondrial membrane and all that. So it's a heart healthy type diet as well. And then if you're familiar with the Hills line of products and the S+OX shield, or the SOX shield as I like to call it, this food also has that, which means it helps reduce the occurrence of struvite and calcium oxalate crystals. So a lot of these little guys, right, are going to be prone to issues like that. Oh, and then as well, so it's a moderate protein diet. It's low in sodium. It does have some soluble fiber in there as part of its kidney bundle, so that active biome kidney defense. But that also makes it really attractive as a liver diet. And so it's got a moderate protein level, so it's in the 5s, and moderate's like 5 to 7. Mm-hmm. When we think about a chronic liver patient, oftentimes we're reaching for something that's labeled for liver disease, like an LD or something like that. But those dogs don't always need that protein restriction. A lot of times they actually need more of a moderate protein to help support the liver health, any kind of healing that needs to go on. And so this diet actually fits right nicely in there, where it's a moderate protein diet. It is lower in sodium in case we have any kind of portal hypertension going on, but it has a really nice profile for that as well.
Yeah,
so
that makes sense.
All those things together.
Where do you see veterinarians reaching for this and doing well. So I guess what I'm saying is, when you think about the vets out there who have multi-organ on their shelves in their practice, who's doing it right? Who's using it well? And what are they doing? Like, are there cases that are getting where this is really benefiting and you seeing some doctors reaching for it, whereas other doctors might not, like they might stand out in their mind as far as this is a great case for multi-organ? Are there any sort of tips and hacks like that you're seeing? I said, I know, so we've got multi-organ on the shelf, for example, and I look at it and sometimes I'm like, I wonder which cases I'm not thinking about this where I think it could be valuable. And so, yeah, is there any best practices that you're seeing?
Sure. It's kind of, if you think about your Hot Mess Express cases that have a lot of things going on, and you kind of need it to be a moderate, lot of nutrients kind of diet, right? You need like a low, moderate fat. You need a moderate protein. You need the minerals to be moderate levels. You need it to be highly digestible because they're having GI issues. Maybe they're also having diarrhea. This is the diet that I would be reaching for. I used to use this, not multi-organ, but GD all the time in the ICU when I was a resident because it really fit those. I have a dog with 4 problems.
Yes.
They're all conflicting each other. And none of them are in conflict with each other with this kind of nutrient profile.
Yeah. So like the dental disease, liver mass, bladder stones, irritable bowel disease dog with not great kidneys.
That would be perfect.
That would be the one. Okay, great. Good. All right, good. I have those patients, and like that's what I was looking for. Is whenever I see the Hot Mess Express, that's when the bells need to go off in my head of like, hey, we should start thinking about what this patient needs in its diet, and then let's start to match up. But that's super helpful for me. Are there any pitfalls that you see vets falling into either by reaching for the diet too soon or by not reaching for the diet, things like that? We're talking sort of best practices. Are there mistakes you see people making? The transition thing earlier is a great example. Like that slow transition. If you've got a fragile patient, that's a pitfall that might have gotten me. And I'm so glad we talked about that. So are there other pitfalls or things that you see people sort of falling into as they start to make a diet switch or to reach for multi-organ?
I think the transition's going to be the biggest one. You have to kind of look at which issue is going to be the most pressing for the patient. And for example, in this dog, in this Murph dog, if his IBD had been like a raging PLE, for example, that was or like a lymphangiectasia that needed serious fat restriction, and he was, on a diet that was a lot lower, that might be the case where this diet's not for that dog, and maybe we need to compromise in other places. But that's probably the biggest potential issue that I might think of is those very, very, very fat sensitive dogs. That's otherwise, it's a very applicable kind of diet. That's
fantastic. That's exactly what I was looking for. Is there's always something where I say that's the big mistake that I want to make sure that I don't make, and so that's really, really helpful. All right. So Caitlyn, this is super helpful. Is there any last minute words of advice or anything you have for me with the Murfster as far as sort of transitioning over to him? We talked to, I think the slow transition is going to help me talking to his owners quite a bit. Is there any other points that you would like to make or anything else that I'm missing?
I don't think it's anything we're missing. I think we talked about it at the beginning, but maybe when we're re-discussing Murph's kind of digestive issues with his owners, education on his treats and what he might have access to throughout the day, maybe if there's kids or if there's guests over, what are some acceptable options for this dog? What has he responded well to in the past? What's not going to upset his renal disease? And, maybe even something as simple as setting aside some of his regular food so that if you have guests, they can give it to him and it's not going to upset. But I think treats are one of those things that get overlooked but are a huge part of the conversation.
Yeah. That's outstanding. Well, Caitlyn, thank you so much. If people are all fired up about canine multi-organ and they're like, I want to learn more, help me get my head around this, where do you send them to get this insight?
So I like to send them to our hillsvet.com page, and from there you can go on our Hills Veterinary Academy and learn all about multi-organ, but also a lot of the rest of the diets. And even if you're not on HVA, if you're looking at the other parts of the website, things like the product guide are there as well. So you can look up all the nutritional information about multi-organ and make your best feeding recommendation.
That's super helpful. I'll put links to that in the show notes so everybody can check it out.
Awesome.
Caitlyn, thanks for being here. Guys, thanks for tuning in and listening, everybody. Take care of yourselves.
Thank you.
And that's what we got. Guys, thanks for being here. Thanks to Caitlyn for being here. Thanks to Hills Pet Nutrition for making this episode possible. Gang, I linked up everything in the show notes if you want to learn more about Canine Multi-Organ Diet. If you want to learn more about Hills Canine Multi-Organ, I got you covered. Links in the show notes, as I said. Gang, take care of yourselves, everybody. I'll talk to you later.